Hello everyone, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. It's been about 6 months since we first televised the episode on coronavirus, and with so much that's happened since then, we felt it was important to have another program. You know, these days, nearly every news broadcast includes the latest reports on coronavirus. According to the Washington Post, the global tally of officially confirmed coronavirus cases surpassed 40 million on Monday, October 19th, 2020, amid new surges in the United States and Europe. Since February 2020, more than 8,179,000 infections and 219,000 fatalities have been reported in the United States. Around the country, reactions range widely from nonchalance to hysteria. Since February 2020, our lives have been altered by the COVID-19 pandemic in previously unimaginable ways, testing our ability to adapt and pushing some of us to the limit. Today on Wellness Spotlight, we have a panel of distinguished experts to update us on the latest developments. Let me introduce them to you now. Dr. Tracy Zivin-Tutela is a board-certified infectious diseases specialist and the owner of Infectious Diseases Specialist of New Jersey. You may remember Dr. Zivin-Tutela appeared on Wellness Spotlight in February 2020 for our first program about coronavirus that I spoke of before. She currently practices in New Brunswick, New Jersey, caring for patients in general infectious diseases as well as hyperbaric and wound care medicine. She's been featured in numerous media venues, including NBC Nightly News, Dr. Oz Show, Good Morning America, as well as Parenting Magazine and the New York Daily News. She was named Super Doctor's Rising Star in New York, along with New Jersey Monthly's Top Doctors 2019. Dr. Alan Webb is a New Jersey licensed psychologist. He is founder and executive director of Stress and Anxiety Services of New Jersey, a multi-therapist independent practice with office suites in East Brunswick and Florham Park, specializing in individual as well as group cognitive behavioral treatment of anxiety disorders in children, adolescents, and adults. His book, entitled OCD Treatment Through Storytelling, A Strategy for Successful Therapy, is published by Oxford University Press. He has been interviewed by NPR, featured on ABC TV's 2020 and Primetime, blogs for psychologytoday.com, and is featured in the Practice's OCD Tips series on their YouTube channel. Completing our panel of experts is Dr. Brad Cohen. An OBGYN for the past 30 years, Dr. Cohen's practice is located in East Brunswick. He received his medical degree from Rutgers, New Jersey Medical School, followed by an MBA from Rutgers Business School. Previously on the East Brunswick Board of Education from 2010 to 2016, Dr. Cohen has been the mayor of East Brunswick for the past 4 years. He was elected on his promise to provide East Brunswick residents effective financial policy with more community services, programs, and opportunities. Dr. Zivin-Tutela, thank you so much for being back on Wellness Spotlight.
Thanks for having me. Glad to be here.
Thank you. You know, it's been about 6 months since you first appeared on our program, and a lot's happened since then. Do you think people in this area still really need to be concerned about COVID-19 and coronavirus?
Yeah, unfortunately, we're in a better place than we were in the spring, but we are starting to see an increase in our local community. Significant increase in COVID cases now versus the last few months. We had a little bit of a breather over the summer, but we're definitely on the incline. So we need people to start remembering the masking and the distance and putting their guards back up.
I guess just one look at us answers that question, because here we are wearing masks. What have we learned about COVID-19 that we didn't know 6 months ago? We were one of the first public access stations to have a program on COVID-19, which was very groundbreaking at the time. Since then, what did we know now that we didn't know then?
So we know a lot more about the virus and the transmission. We know it's absolutely droplet is the main source of transmission, which means you're speaking to me in close quarters and sharing saliva and close quarters speaking, singing, so on and so forth. We know now over the last few months, and it's made a little bit more public attention, that there is a component of airborne. And what that means is an airborne transmission means if you're yelling and screaming, it may be beyond 6 feet. It may be 15 or 20 feet. If you're exercising, the spread may be further than the 6 feet. We know that there are still contact plays a role, but a much less of a role.
Touching surfaces that have been exposed.
Touching groceries, touching doorknobs. We know that that is much less of a way to transmit the virus, but we know that it's still a possibility.
People are having their temperature checked, going to doctor's offices, going into restaurants, and so on. What is considered a red flag in temperature?
So the red flag for temperature screening is 99.5. And the definition of a fever has been argued in medicine for a long, long time. And if you can read 10 different things, and people would have 10 different answers. But we know with this virus, in the beginning stages, it's a very low, subtle temperature. A lot of people don't recognize a 99.5 temperature. They just don't feel that, it's not the same as the chills or the shakes of a 101 or a 102. So 99.5 is the threshold for this virus. You can get higher fevers. That's usually a little bit longer into the course of the disease. But early on, 99.5 we know is a good cutoff, which is why we're doing screening, because you may not actually feel it yourself. But if someone's taking your temperature and it's noted, that may be one of the symptoms that you didn't recognize in yourself.
Before it develops into other
Correct.
symptoms.
Other symptoms. Mm-hmm.
And if somebody's flagged at 99.5 or higher, what should they do?
So it depends on where you are or what you're doing. So if you have a 99.5 and you're going into a restaurant or a doctor's office or a school, you should immediately not go in, or you should not be allowed in, and you should go home. You should call your doctor. You can monitor yourself for other symptoms as well, such as loss of taste or smell, or fatigue, cough, runny nose. There's a whole myriad of symptoms that go along with COVID-19. But really, watching that 99.5, it should halt you from going to be around the public.
I see. What are you recommending for somebody who has been exposed to coronavirus or been around someone who has been tested positive?
So anybody with a known exposure to a positive case should self-isolate at home, preferably in a room and a bathroom separate from the rest of family members, because not everyone's exposed. So if somebody was exposed at a workplace or at a party, but the other family members weren't there, they should isolate and separate out from the family. 14 days, and we recommend around day 7 the option to test. Now, if you get a test on day 7 and you're negative, it doesn't give you a free pass to get out of the 14-day isolation quarantine. It's just telling you that at that point you're negative. There are some countries, such as New Zealand, that if you're exposed, they test you on day 3 and day 13 because they're trying to catch the positive, so then they can then contact trace your contacts, your previous contacts. So in this country, we're not doing that, but average is about day 7. I see a lot of people who are exposed and immediately go get a test the next day. Almost always that test is going to be negative, and that gives them a false sense of security. And sometimes they put their guard down and they said, I don't need to do this 14-day quarantine, I feel fine. And then they go out into the public, and then that's a risk to other people.
For people who have contracted the virus and recovered, what residual effects do most people experience?
So we call them long haulers, and we are seeing and we're learning every day more and more with patients who have recovered from COVID-19, whether it be in the hospital or at home. We are seeing a lot of fatigue. We're seeing a lot of mental fog, where they just don't feel that they can remember things the way they did before. We're seeing a lot of patients come back with chest pain and palpitations that don't necessarily have an etiology, meaning we don't really know. We do a million tests on them and there's not a clear cause. So I would say those are the ones we're learning about right now, and there are local, what we call long hauler clinics, post-COVID clinics in our region, in our area, that are accepting patients and studying these patients.
We know there are a few different tests that are out there for coronavirus. There's one where you get an immediate result and then one that's a few days later. Which one do you recommend as being the best and most reliable?
Sure, the best and most reliable is the PCR test, and that can be a nasopharyngeal test, so that's the one that they stick all the way back in your nose that makes your eyes water. It can be a different part of your nose that's not as far back, or it can be a saliva test. All of those are what we call PCR tests. That's the most sensitive, the best diagnosis. That's what we call the gold standard. The rapid tests are also with the swab. Those tests have their place, especially when we don't have enough PCR tests or we need other answers, but they're not as accurate. So in asymptomatic patients, meaning someone who just got exposed or just wants a test because they want a test before they go see grandma, the rapid tests are not as reliable.
So the PCR is the 3-day?
It depends on, it 100% depends on the day and the week. We went from having it take a week down to 1 to 2 days. Sometimes it goes back up to 7 days, so it depends. On average now, I think it's about 2 to 3 days in our area.
Good to know. A while ago, we used to hear about a shortage of respirators, but now we don't really hear or see too much about that anymore in the news. Why is that?
So we learned a lot from spring until now, and what we learned is that some of our simple interventions in these critically ill patients, including the use of steroids and blood thinners, has actually halted the need for people, or as many people, to need a ventilator in the hospital. We've also switched our gear after realizing the damage that's the type of damage in the lung with COVID-19, which is very different than most other respiratory illnesses that we see, and that there's other ways of providing oxygen that may be even better. We are still using ventilators, unfortunately. We are not at a place where we have a shortage, which is nice, and I'm hoping we won't be in that place again.
We see that they're in the process of developing a vaccine. They're rushing to do that. Would you recommend this vaccine for the elderly or for very young children who tend to be more immunosuppressed than most of the rest of the population?
So vaccines, the vaccine in children has not been studied yet. One of the companies just got approval for under age 12, hasn't even started enrolling yet. So kids will be much further down the line before adults will. Right now, there's a lot of race for these different vaccines, and there is a plan on how to give them out and who to give them to, and that's actually coming from state and national levels based on ethics and need. And I'm sure we will have a vaccine soon. We are waiting on safety data and safety profiles, which is what we need for vaccines, and I'm sure that we will get there soon. But elderly will be included in the first batch, as well as healthcare workers and probably older students as well.
How's the vaccine designed to work inside the body?
So there's a few different types of vaccines that they're working on, and basically they're trying to, if you ever look at the picture of the coronavirus, it has all those spikes.
Right.
Looks like a pretty crown, and it attaches to the spike to inactivate it. That's probably the simplest way to explain it.
So it prevents it, those spikes are designed in the replication process, so it stops it from reproducing.
Right, and attaching into the lung or other body parts.
Are there any risks to being vaccinated against coronavirus, and if so, what are they?
We don't know yet, so we're waiting on all the safety data. And I know in the news there's been a few studies that have been halted for safety purposes, and I think everyone immediately gets hesitant and says, "See, we don't want this vaccine because it's being halted." But this is the natural process of developing a vaccine. There are safety panels that are unbiased safety panels that are people who do not work for the company, they're not politicians, they're not anything. They are individual.
Have no financial interest.
No financial interest, right. So they are individuals who their entire purpose is to make sure that what is being produced is safe. So normally in our safety, when we produce a vaccine, we have these halts to make sure that there's not a problem, and then we resume. This is completely normal.
Are there any reasons why a person should not be vaccinated?
Right now, we do not have any data on who shouldn't be. The only thing that comes to mind will possibly be people who have a history of Guillain-Barré or transverse myelitis. Similar to the flu vaccine, we do not give it to patients who have had a previous history of those two diseases, because we know it could trigger a relapse of those diseases. So we don't know yet for the coronavirus vaccine, but I would hedge my bet that may be an exclusion.
I know that many drug companies are in the process of developing an antiviral drug that's to be taken by mouth. How does it differ from the inoculation?
So they're looking at a virus that you can take in that will be not as strong as actually getting the virus and allowing your body to have an immune response that's natural. An
attenuated.
Right. An attenuated virus that allows you to just naturally respond without having the exaggerated symptoms and inflammatory response.
How is each being recommended between the vaccine and the oral?
Oral's still in developmental stages, so we're not even there yet. Right now, we just don't have enough information. I'm sure the injected vaccine will be the first to come out. Which one, I don't know. There's several right now in phase 3 trials. Oral will be behind, but we'll see. We just don't have enough information yet.
Dr. Zivin-Tutela, if someone is vaccinated against coronavirus, do you still feel they need a flu shot?
Absolutely, 100%. So right now, we know that in the southern hemisphere, the flu season was pretty mild. And we're really hoping that our season will be mild as well. But the reason I have told everyone and anyone, patients and friends, to go and get their flu vaccine early and get it now is because if you are at risk for getting the flu and you are susceptible for any reason, that means you had a break in your mask and your social distancing. So you had a break in your protective measures. If you are at risk for getting the flu, you're just as likely to be at risk for having coronavirus since it's circulating significantly in our country. And so the two together, we know, has a poor outcome compared to just one or the other. So if you protect yourself with the flu vaccine, then you're protecting yourself from getting both at the same time.
I understand that if a person is infected with coronavirus and recovers, there's a good chance that they could be infected again and come down with it. Is that true? Or once infected, do they have immunity against it and then they don't have to worry?
So we don't have what we call an immunity passport yet. That means you got it and you can go on your way and live life and travel and go back to pre-COVID times. Unfortunately, we're not there yet. There have been cases of reinfection. They're small. We don't know the exact numbers. The CDC is still pulling data. I submitted some cases to them myself. That is being looked at. So we know for sure that reinfection has occurred, and we can prove it by looking at like the fingerprint of the virus in the person's blood. But there are other cases that have looked like reinfection that we haven't been able to prove it because we haven't been able to look at that fingerprint. So what I would say is if you had coronavirus or you just had it, that you are not Superman now, you are not protected, and I would still continue to take the same precautions.
I think it's also important to note, in addition to discussing vaccines and medication, the importance of following the regimen of a healthy lifestyle. getting your rest, making sure you're not overweight, eating right, exercising,
Keeping your stress levels down.
keeping your stress levels down, and making sure that your body's firing on all 8 cylinders and functioning at its best.
Absolutely. We know that most bacterial infections, but absolutely viral infections, hit you when you're down. So you're not sleeping well, you're not eating well, you're not taking care of yourself. So the best thing you can do, besides washing your hands, wear a mask, keep your distance, limit exposures that are unnecessary, is exercise every day, get sleep, have a healthy diet, try anti-inflammatory diet, and just try to be the best that you can.
Yes. We're taping this program at the time where, it's just about Halloween soon, and then we get into the end of year holidays. How do you recommend people celebrate this year?
Well, it's difficult. It's very difficult. So I think there's a lot of people being very creative with Halloween. I think the town of East Brunswick is being very creative with Halloween and having alternate ways to enjoy the holiday. I truly believe that people thought they were going to get together for Thanksgiving and Christmas and are starting to realize that maybe that's not a good idea. I would absolutely recommend holidays being just the people you live with, because the people you live with are your bubble. They're the people you are exposed to. Once you start going outside that bubble, you are risking with each person you involve. So I would say let's look back to Easter and Passover and the spring holidays, where we all had our meals and went on Zoom and did it together that way.
Thank you. As we wrap up this interview with you, are there any last thoughts that you'd like to share with our viewers?
I think the biggest thing is to really be cautious. I think our community has been very cautious with going out and being responsible. Most of the time, almost always you see people with masks, or if they're walking and they have a mask in case they see someone, and that's great. But we also need to be very vigilant with the people we love and care about, because as much as we want to see them and be with them, we also don't want to be the one who gives them this infection or vice versa. So as much as we are all fatigued and tired and exhausted of all of this pandemic world, we have a ways to go. And we really need to really keep our guard up and really protect the ones we love and that we care about.
Thank you. Thank you so much, Dr. Zivin-Tutela. Thank you again for appearing on Wellness Spotlight and for sharing this terrific information with us.
Thank you for having me.
Appreciate it. And be well.
Be well.
So now I'd like to move with our mayor, Dr. Brad Cohen. Mayor Cohen, you've reported that East Brunswick has one of the lowest COVID-19 rates in all of Middlesex County for a term with long-term care facilities. Why do you think that is?
Well, I think there's several reasons. One, we acted very early at the very beginning of this crisis and shut businesses down, shut a lot of daycare centers down before it was an executive order to do so.
Can you disclose the numbers to us?
The numbers of what?
In other words, how many cases we've had?
I don't have the exact number in front of me right now, but the total number is somewhere around 800. But you have to do that and take into consideration the population. So that's how we come up with our rates. And our numbers have been low and persistently low, and I think that that's persisted because we made that big effort to shut things down in the beginning. And got a little flack actually from Trenton about that, because they didn't believe that we had the right to shut things down without the executive order of the governor. But at the end of the day, I think by the time it all rolled around and the governor got around to doing it, we had already shut down a good week to 10 days before everyone else. And that difference and that lower rate has persisted throughout. And I do think it's unfair to compare a town like ours to a town that does not have long-term care facilities, because we all know that at the very beginning of this crisis that the hospitals were discharging people with COVID to rehab centers, and those centers very early on, I'm sure we all still remember, didn't have the PPE. They didn't have official guidelines from the state or the federal government on how to cohort people within those facilities. And we saw a lot of disease and spread of disease that we now would never see in many of the other places. The other states even where we're seeing numbers rise aren't seeing that level because they learned from the mistakes, unfortunately, that we saw on the East Coast. So I think our early action was part of it. And I think the other thing is that we're a fairly educated community, and we are following the guidelines and doing what we're supposed to. And when you follow the guidelines, just like the doctor was saying, we tend to see lower numbers of cases. It works.
What did you learn about East Brunswick during the pandemic?
I think we're a resilient town. We're very innovative. We've all figured out very quickly that we've got to figure out another way of meeting and congregating and getting the business of the town done. And we were able to adapt fairly quickly. Our library, our business end of the township, the planning and engineering, everybody at Parks and Rec, all figured out how to do ways to get people to socialize, but in a socially distant way. So the virtual thing took over, and I think we've just learned how to operate in a different mode, and I'm not so sure that that's going to change very soon. Schools, we were one of the first people to put together a hybrid plan, and one that was accepted by the state as a model program. And clearly by following the guidelines, we were able to open up school when almost, well, actually every other schools in Middlesex County was closed.
Right.
And yet we've done remarkably well. And I think it's just a testament to everybody putting their heads together and figuring out how to make this work and do so in a way that follows the guidelines.
Where we had cases, were there any areas of town or certain demographics that were affected more than others?
Well, in the beginning, we did see a larger number of fatalities in the older age group, and they were almost all isolated to the long-term care facilities. And again, we could go over that, but we've all learned from that, unfortunately. But that was the wave that was in the beginning in the spring. And it did tend to favor older age groups of individuals. Now that we've all managed to get that under control, East Brunswick and the state in general has done a very good job after the spring of following the rules, and we've been able to keep our numbers pretty low. And like was mentioned by the doctor, we have seen in the state a slight uptick recently. But I've looked much more in depth at East Brunswick in general compared to even the state. And our numbers have stayed relatively flat, even with opening school. I don't have a crystal ball, right? And so I can't tell you what's going to happen next week. I could look like a fool, and the numbers will go off the chart. I don't anticipate that, but we've done very, very well, all things considered, and even having school open. So I think the numbers speak for themselves.
Mayor Cohen, you kept our parks open.
Yes.
Even when the governor's, during the lockdown.
Right.
Even when the governor's executive order closed them in the state.
Right.
Why'd you do that?
Well, that kind of goes back to your whole philosophy of wellness, right? I think that the lockdown forced everybody to be indoors, and that's strain emotionally on people, physically on people. And I had faith that people in town would do the right thing. If you kept your social distancing and you did everything that you're supposed to by guidelines, I wanted people to get out and use the parks and get out and jog and run, clear your head. This is all going to help your immune system, your sense of wellness, which boosts your immune system, and it tends to make you more likely to fight disease. So I thought that there was no reason for us to do that. If I saw that there was rampant abuse, and I'd have no choice. But again, we're a resilient people. We know what we were told we had to do, and we followed the rules, and there was no reason to shut that down. So I'm never one of those people that feels that you need to make a hard and fast rule. You got to know your population, and I'm not afraid to be the only one to do something if I know that it's right. Shutting down before everybody else, I didn't need them to tell us that from the state that was the right thing to do. Keeping parks open, I really didn't care what they did in the state. I knew our population of people living here could do this. So I think we're all learning as this goes along. And unfortunately, maybe 5-10 years from now, when we all have the beauty of being able to look back at this pandemic in the retrospective viewpoint, it's going to be obvious all the things we did right and did wrong. We don't have that advantage now. We're in the moment, and we need to act on what we believe is in the best course based on the science.
You spearheaded a special testing program, a COVID-19 testing program between Middlesex County and the East Brunswick public school system. Could you tell us more about that?
Well, we all know that our public school system put together a hybrid program that was recognized as very good, and it really was. But the reality is that unless you're doing regular testing, it's going to be hard to slow down or identify super spreader events after the fact. So the goal is to add layer of testing to the program that we already had. That's the only thing that I believe we could do that would make keeping school open safer. And it's not novel. Other schools have been doing it, colleges have been doing it, businesses have been doing it. But what I did do is I did a little research, just like we're all supposed to be doing, and identified the Air Force Academy, which was looking at their population of cadets. And they had the advantage of having a whole pandemic math team of epidemiologists, biologists, statisticians, and they put together a formula that was called the Fizzle equation, which uses different variables to figure out the number of people and the frequency of testing that could be done on a population in order to prevent super spreader events from occurring. You can't prevent COVID, but you can prevent it and find people early enough that you could identify the contacts and not have it spread through the entire population, forcing it to shut down. And the parameters that go into that equation includes obviously the number, the population, the sensitivity of the test that you're using, the underlying transmission rate in the community, the time frame it takes for the turnaround of test. All of that was factored in. And interestingly enough, our population size-wise wasn't much different than cadets. They have 4,000 cadets. We have 8,000 kids in our school system, but only 50% were doing the hybrid. So that number was about the same. And they had about 1,000 in terms of their faculty. We had about 1,500 in faculty and administrators. That's a closed system. Ours is an open system. So it's not exactly identical. But our numbers, based on throwing in the parameters that apply to us, came out with the same 15% per week testing rate. And we're going to do that as a pilot, but the only way to do that was to partner with someone who could provide the tests. And the county provides screening regularly for free. So we asked them if, and they get that through the CARES Act. So we asked them if only school that we're open, can we actually use the testing in our school system as a way of confirming that we could keep school open safely, and do that as a pilot and a model for other schools in the county and learn from us. So they were actually very eager, and I'm thankful to them because they're going to test for free the first 6,000. Will get us a round through of everybody being tested. It's the saliva test, which you mentioned earlier is the PCR test, and it's a 48-hour turnaround that they're promising for us. And when you factored all that in, that's how we came up with the 15%. We'll look at our numbers. Maybe we need to do more. Maybe we could do less. We'll have to look at that. And ultimately, if it is successful and it is proving that we're able to keep school open, then we'll switch it over to private insurance, which all the teachers have. Most of the faculty all have, administrators, most of the students. And for anyone that doesn't, we'll go to area charities and civic groups and religious groups to help bring the money to cover people that don't have insurance. We don't want people not to be tested because of an insurance issue.
Any last thoughts as we close this interview together that you'd like to share with the viewers, Mayor Cohen?
Well, I think we're not over this yet, right? And we've done well. Our numbers say we've done well. There's a little bit of a spike on the state level. We need to see where that's coming from. I believe from what they're listening from the state level, it doesn't seem that it's because of schools. That doesn't seem like it's because of restaurants opening. I think what they're seem to be honing in on are the parties and the people who are grouping in their own homes as one of the biggest reasons for the spread and the rise in numbers. They're not able to make that conclusion yet, but I think that's where their head is at on that right now. And I think that kind of ties into the idea of we're not quite ready to have everybody over for Thanksgiving or Christmas or Hanukkah yet. We're just not quite there. So I think we just need to still be diligent, but we've come a long way and we should be happy with our success. And I think we all as a community should be thankful that we're where we are right now, because everybody played a part in us getting there.
I think that as a community, we should be thankful that we had a physician, who was mayor, who had the knowledge and the background and the experience,
right?
To be able to understand what was really going on, better than a layperson, and could make some tough decisions for the public welfare. And from my own personal, my own personal opinion is I think we were very lucky that it was you.
Thank you.
So thank you for all of the hard work that you've done and looking out for us, and you continue to do. And
thank you. But I do have to say it's a team. We have a really great help behind. Nobody does this by themselves. We have a Office of Emergency Management in John Cossack, who's been doing this for 40 years. My business administrator, Joe Crisculo, is part of my team. He's been in this business for 30 years. Chief of Police, Frank Lasacco, he's been a part of East Brunswick Police for 30 years. So I had a team of people that have 100 years of experience.
Mike Reisner at Parks and Rec.
We have some really great people that work here, and they take their job serious. Look, we kept the pool open this summer when everyone else around us was closing them, and we followed guidelines, and we had no cases at the pool. None of our employees got sick. We sent our employees home early, right at the very beginning of this crisis, with computers, just work from home. We've had, as of August, which is the last time we got numbers back from our insurance, we self-insure all of our employees, so I look at the numbers all the time. And we had a total of 8 COVID cases among 1,200 insured lives. That's pretty remarkable.
That is.
So, I don't want to wake up tomorrow and find out that we just had, a dozen people diagnosed, but it just means that everybody's been taking this seriously, and we all worked as a team to get where we are. We just can't let up now.
Well, thank you for leading the team, Mayor Cohen.
Thank you.
And thank you for being here on Wellness Spotlight.
Thanks, Ken.
We're going to be going with Dr. Alan Webb next, and he's going to be speaking with us about the emotional component of COVID-19 and the effects that it's had on all of us, and some tips on what we can do. Dr. Webb, welcome to Wellness Spotlight. Welcome back. It's been a while since you were on.
Thank you, Ken. It's great to be back.
Alan, what's the most challenging thing for most people that are living in a COVID, Madonna said we're living in a material world, now we're living in a COVID-19 world.
Right.
What's the most challenging thing about living in this world now?
The theme seems to be, and this is, it's personal, from friends I talk to, from a lot of the clients that I work with, it's really about dealing with uncertainty. And I mean, that's really the theme. How long is this thing going to last? Will the vaccine work? Should I take the vaccine when it's available? Is my job secure? Or if I don't have a job, how long will this, how long will I be solvent? Will my kids be safe at school? Will I be safe when I go to the supermarket? Or when I go to work if I'm commuting to work? I mean, there's just so many questions that are left unanswered. And, when you know something bad is going to happen, that's one kind of anxiety. But when you don't know whether or not something might happen that's bad, that's a kind of a different kind of anxiety, and it really creates a lot of stress for people.
Why do you think stress is, what I should say it this way, why do you think change is so stressful for many people?
Well, first of all, it's not always stressful for everybody. I mean, there's some people who really thrive on change.
I said many people.
But yeah, there's, overall, we're creatures of habit, and when you learn how to be a certain way, there's a certain amount of energy that's required in terms of making a change. Think about any habit that you have. Try brushing your teeth with your other hand. Just about anything that you do requires a certain amount of effort and energy to adapt to a change. And so there's a lot of adaptation that's needing to go on these days. I mean, this last 8 months has been really rough on a lot of people in terms of the multiple kinds of changes that have to take place, whether it has to do with their world of work or their world of home or their world of child raising or their relationships with their extended family members. It's really just about every aspect of our lives have been dramatically altered.
What are some ideas that you can share for people who are trying to cope in an age of COVID-19?
Well, I would say to you, based on the first answer that I gave to you, is learning how to accept uncertainty. Which we really already do. Ken, when you, even pre-COVID, when you get into your car and you go on the New Jersey Turnpike or the Garden State Parkway, you can wear your seatbelt and you can make sure you have a car that have crumple zones and airbags, and you can adjust your mirrors and you can drive defensively, but there's no guarantee that you're going to get to where you're going without getting into a significant car accident. We don't let that stop us from getting in the car and going. We learn how to manage uncertainty. And this is really no different than that. So that's a big theme. But I think that when we talk to people who are really struggling, it really starts with self-care, making sure you get the sleep that you need, making sure that you're eating well and not binge eating or emotional eating. Making sure that you're exercising and you're moving your body, which is a little more tough these days because a lot of people aren't going to the gym. Right now, the weather's still in October, nice enough. It's going to get a little tougher moving forward. But you could be running around the house with your kids. I mean, just something to keep your body moving. Dealing with things one step at a time and not focusing so much on the big picture sometimes can be very, very helpful. So, those are some of the strategies in terms of trying to help manage this time.
By way of thinking, what do you recommend people dwell on when they're thinking? Is it just a matter of being more positive? We never know what tomorrow is going to bring. So is it a matter of seeing the world as a friendly place and hoping for the best?
I think that's true, but the line that we typically give people who are in crisis is to say to yourself something along the lines of, where I am right now, what's happening right now, it's time limited, and I have to trust that it's manageable. So this is a particularly tough time with COVID-19 because we've already been in this thing for a really long time, and now they're telling us it's going to be another really long time before there's a light at the end of the tunnel, and we're going into shorter days and colder days, and it's just going to be more challenging than it's been up to this point. It's scary, it's hard. But the idea is it's gonna end, even if it doesn't go back exactly the way things used to be. After 9/11, airports were never really the same, right? But we learn to adjust and we learn to adapt, and we'll do that with this too. And it's about trusting that that's the case and taking that larger perspective that this is going to not be this way forever, and until the time that it gets there, I'm going to be able to manage. That's the line.
So in the meantime, people are saying, I'm feeling so anxious and I'm feeling so depressed about everything going on. How do you recommend they manage those feelings?
Well, I'm a psychologist, so I'm going to say talking about it with people is really very important. Sharing it with your family and friends. You want to make sure that you're not socially isolating. And so even though it's virtual, staying connected with people. In fact, a lot of people report that they've been connecting with people that they wouldn't normally connect with just because of what's going on. And so, they have virtual dates with people that they haven't seen for years, that kind of thing. Doing that is really very important, making connections with family and friends. Ultimately, of course, if you really are having a hard time, mental health professionals pretty much everywhere are doing virtual therapy or are doing virtual counseling, and they do therapy over the internet, and they're available to help.
You probably speak to a number of people whose significant others during this time have been acting nasty to them and snapping and acting out and biting because of being together so
Yes.
much. Why do people act that way to the people who love them the most?
Well, for many, many people, when you're stressed out, you end up really kind of being in a bad mood.
Is it because they're afraid?
Well, I mean, I think to some degree, most people have some anxiety and fear about what's happening here. But it really is the whole idea of anxiety and stress that tends to fuel aggressive behavior. Not all the time when you have aggressive behavior, but you know, it's sort of like the day where the alarm goes off late and you jump out of bed and you stub your toe and you drop the soap in the shower and you pick up your head and you hit the faucet and you bang your head and you're running downstairs because you're late and you rip your shirt, so you have to go and put another shirt on, and you grab a cup of coffee because there's no time for breakfast, and you spill the coffee and you have to go and get another shirt, and then you're rushing and you're weaving in and out of traffic and you get into a fender bender, and then you get to work and you get in trouble with your boss, and the whole day is like that. You're going to be in a really nasty mood, you know, for the rest of that day. That's just sort of the way it works.
That was my morning.
I'm sorry to hear that. Should have given me a call.
It's a good thing we can laugh.
And humor, of course, you know, I didn't say that, but humor is really very, very important. I mean, I think you have to watch in terms of binge watching shows that a lot of people are doing. I don't think it's a terrible thing. I think the thing that you have to be careful about, really, is binge watching the news. A lot of the news, regardless of what your politics are, it's just bad news, and it's depressing, or it's anxiety-provoking, or it's anger-making. And I think that you know, what we typically recommend is, if you really want to know what's going on, watch the news once, get the information, and then keep away from it for the rest of the day. Don't go belly aching on Facebook about this or that. It really doesn't help anything except just make you feel more helpless and miserable. And you really want to try to use this time in as constructive a way as possible.
Yes, watch Wellness Spotlight.
Yes, like watching Wellness Spotlight.
Will this experience that people are going through, Alan, will it make them have OCD?
Now, this is a really interesting question because, you know, I do a lot of work with OCD.
Yes, you're a specialist in treating this.
I am. A lot of people were asking about that, whether this will make them you know, obsessive compulsive. It may make them a little hypervigilant. You know, they're over careful, they're watching things, they're thinking about things in a way that they hadn't, especially in the very beginning when everybody was kind of like wiping down all their groceries when they brought them home and holding the mail for 3 days before they opened it up. Most people are not doing that anymore because they kind of changed the information on that.
Yes.
But you know, OCD is a psychiatric disorder that's really very serious. And it isn't about being quirky, it isn't about being, you know, meticulous about things. When people are engaged in, well, you know, they get obsessions like, you know, maybe which are intrusive thoughts that make them anxious, and maybe this is, you know, maybe this is contaminated, and then they engage in compulsive behaviors like hand washing. When they do these kinds of things, most of the time they themselves recognize this is really unreasonable, but my anxiety is so high that I really can't control my behavior. On the other hand, when we're doing these behaviors now, we're responding to an actually perceived threat that, you know, that seems kind of real, even though the specific rules around it keep changing. And so unless you're becoming miserable in the act of doing the things you're doing or making other people miserable around you, we don't really consider it anything like OCD.
Alan, how does a person manage their anxiety when it comes to socializing with people, whether they're socializing in person with them or they're socializing virtually?
Well, let me talk first about in person. And you know, when you called me and asked me to come to this interview, you know, I grilled you with a whole bunch of questions. Well, where this is going to be? It's going to be indoors? Are we going to be wearing masks? How far apart are we going to be? How's that going to work? And I basically tell people, if you're going to have some kind of a gathering or getting together with anybody, you have to first think to yourself, what am I comfortable with? What am I okay with? And then communicate to the people or the person that you're getting together with about what your expectations are, and make sure that it's going to be met, that you're going to be okay. And this way, if you do go and there's a problem, you can bring it to their attention, and it's easier because you've already kind of let them know that this is what you wanted. And if you find that you're not really comfortable because people are not behaving the way that you thought they were going to, you really have to think about leaving. You know, you have to behave in a way that allows you to feel in control and comfortable with your boundaries.
So that's great advice. Now that the holidays are approaching, and you know, it'll probably solve the problem because a lot of families aren't going to be getting together this year like they would have in previous years. Mm-hmm. But if families are together, what other advice that you can give them to make sure everything goes well?
Well, I'm not going to, of course, you have to follow the CDC guidelines as best as you can, but that's not really, I think, what you're asking me here. It really is about opening up about what you're comfortable with and what you're not. And, being in a room, so, I have a 96-year-old mother. I haven't touched her since February. And she's in an assisted living facility. But just being, I'm actually further away from her than you, and we're outside, but just being in her presence is, she lights up. And I do too. And, that being connected in that way is great. And I think it's about focusing on what are you getting, not what are you not getting. Mm-hmm. What are you missing out on? And I can tell you that too, from family gatherings that we've had virtually, where I realized that I have cousins and stuff that are my age, and we were all in the same place on the screen, even though we were all over the world. And there were some of us that had never been all together at the same time in real life, but we had this opportunity. Now, we could have been doing this all along, but who would have think of it,
Yes. That's
so
right.
It's one of those things where, and this is one of the other things that I like to focus on when people are asking me the kinds of questions that you're asking me, which is to begin to ask yourself, how has this been better for me? Well,
what's the silver lining to this cloud?
What is the silver lining to this cloud? So for a lot of people, it's like, well, they don't have the commute, even if I do have my job.
Yes.
That's a big one. Or for a lot of families who haven't had 5 nights of dinner together as a family, like ever, or for years, and then they're doing that now. Things like that. Trying to figure out, people sometimes have found that they have time to engage in hobbies that they've let go for a very long time. I've started playing the piano again. I hadn't really done that for a very, very long time. Things like that, and trying to find the ways in which this is like magic time in some ways, even though it's terrible. We always say crisis equals opportunity. That's true for business. That's true for lots of things. And I think that's true here too.
It's called COVID-19 because it was discovered in 2019, but a lot of people think COVID-19 has to do with the 19 pounds that people have gained since it started. What advice do you have for people who are emotional eaters that are feeling this kind of stress?
First of all, it's about recognizing the problem. It's always first about recognizing the problem and then making the decision that you really want to be working on it. Because even if you recognize the problem, if you don't want to be working on it, then nothing's going to happen. So in psychology, we have a term called motivational interviewing, and if someone is struggling with whether or not they want to put the energy into getting better, we ask them questions like, well, what are the losses that you've had as a result of the problem that you have? And what would be the positive aspects if you made those changes? So, the carrot and the stick kind of thing.
So you move them either toward benefits or away from consequences.
Yes, and so just helping them recognize that this is really something they want to do, rather than just lecturing at them. And so I guess I'm talking to family members who might recognize that somebody has to deal with this kind of problem. But then it really is about, asking for support, making a plan, and really just focusing on a day-to-day. If you end up having specifically like a binge eating issue on a particular day, you can't beat yourself up for it. You have to kind of say, okay, what did I learn from this slip? And what do I need to do tomorrow to make better sure that doesn't happen again. And of course, again, there are very many eating order specialists, and binge eating is a real eating disorder that are available for assistance if that's necessary.
We have time for just one more question. This is terrific information, really, Alan. We really appreciate it.
Thanks, Ken.
There are a lot of parents out there who are worried about their kids doing online learning. What advice do you have for them?
Okay, so that's a whole big thing that we've been dealing with, right? And something really very new for most people. So the first thing is I like to say to the parents, calm down. It's not going to be. This is not going to be something that changes the trajectory of your child's complete academic and professional career. If you really wanted them to go into Harvard and they're in 2nd grade, I don't know that COVID-19 is going to really make the difference. And it's about being a little more patient and kind of lowering standards a little bit. But even when kids are in school, it's really tough, especially for younger kids, middle school kids, to kind of sit in class all the time. And then they have the socialization, they have the art class, they have the recess, they have sports. I mean, there's a million different things that are going on. So to sit and have everything be just in front of the screen is really asking a lot. And so we really suggest to parents that they try to work with their kids on having lots of small breaks that take them away from the screen, so they're not then texting their friends when they're away from the school screen, where they're physically active, where they're out of the space that they were in, where they're doing something interesting or different, listening to music or drawing or just, talking to a family member, and then come back, and then leave, and then come back, and then leave in a structured way. Breaking it up into small pieces is really an important thing. And also making school. So they get up in the morning the way that they used to get up in the morning, maybe later, and they shower, and they dress, and then they sit down. They don't roll out of bed in their pajamas and then attend school. You want to try to give it that sense of structure. And those things can be very helpful. Also, and we do this with kids even in the therapy sessions, having a fidget, just something for them to kind of fiddle with, not something that requires their attention, which is then going to be a distraction, but just something that they can kind of play around with their hands is really a good way for them to center themselves and to express a lot of energy, so they're able to sit a little bit more comfortably and concentrate. Even with kids with ADHD, we find that sometimes, part of a larger program that can be very, very helpful.
Thank you. Thank you so much. Dr. Alan Wegg, I really appreciate you returning to Wellness Spotlight, especially during this time of COVID-19, to share your wonderful expertise and great advice.
I thank you so much again, Ken, for inviting me.
Thank you again.
Take care.
I'd also like to thank our guests, Dr. Tracy Zivin-Tutela and Mayor Brad Cohen, for also appearing on Wellness Spotlight. I'm Dr. Ken Freedman, President of the East Brunswick Advisory Health Council, thanking you for tuning in to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight, and reminding you that wellness works when you work it.